Tethered spinal cord syndrome. What is it? Why does it occur? Tethered spinal cord syndrome is a condition in which the spinal cord is anchored or tethered to surrounding tissues, leading to restriction of its movement. Normally, the spinal cord moves freely within the spinal canal, but in this syndrome, it becomes fixed and cannot move freely. The causes of this syndrome can vary. One of the most common causes is a spinal hernia, where partial or complete closure of the spinal canal leads to the fixation of the spinal cord. Other possible causes include congenital anomalies of the spine, tumors, or scar tissue from surgical interventions. The tethered cord syndrome is usually diagnosed in children, although it can also occur in adults. The typical age for this syndrome ranges from birth to 12 years. The symptoms of this syndrome can vary depending on the degree of tethering of the spinal cord and its location. Patients usually experience lower back pain or leg pain, problems with urination or bowel function, sensory disturbances, or paralysis. Various diagnostic methods are used to diagnose tethered cord syndrome. These include magnetic resonance imaging, MRI, of the spine, which allows visualization of the spinal cord and surrounding tissues, and electromyography, EMG, which assesses muscle and nerve function. If tethered cord syndrome is suspected, it is advisable to consult a neurologist or neurosurgeon. These specialists have experience in diagnosing and treating this condition. The main diagnostic methods include 1. Magnetic resonance imaging, MRI, of the spine. 2. Electromyography, EMG. 3. Ultrasound examination of the spine. 4. Radiological examination of the spine. It is important to note that treatment for tethered spinal cord syndrome typically involves surgical intervention to free the spinal cord and relieve its tethering. After the surgery, physical therapy or rehabilitation may be needed to restore normal function.